A few interesting things that are occurring with light-based technology in industry. I think the one that's getting the most attention recently are the sub-nanosecond lasers, often referred to as picosecond lasers, although the pulse duration is really just a little bit less than the typical Q-switch lasers. But with these short pulses, there's some new, very interesting results with both tattoos and benign pigmented lesions. So that's an interesting aspect. And also with the evolution of fractional lasers, where either small microthermal zones of denatured tissue are created or holes are actually drilled into the skin, that opens up a bunch of new opportunities for lasers in dermatology. It's an interesting question because this society started out as the American Society for Lasers in Medicine and Surgery, and now if you look under ASLMS, it's got a tagline that says energy-based devices. And that's because there are so many other forms of energy besides lasers, besides light, that have come into this society because of mutual interests and similar applications. But there's still a lot of advantages of using light, and particularly lasers. First of all, you have the enormous breadth of optical spectrum available to you, from the ultraviolet through the visible and into the infrared, and then even far infrared all the way out to carbon dioxide at 10.6 microns. So you have that tremendous flexibility. In addition, you have the flexibility of the pulse duration, which can range from having so-called CW operation, where the light is on continuously, CW being continuous wave, or you can produce a pulse of light, and it might be a half a second or a thousandth of a second or a microsecond or a nanosecond or even 100 or 500 picoseconds. So that gives you a tremendous amount of flexibility, not just in the wavelength but also in the pulse duration, which in turn opens up a very broad spectrum of potential applications. Well, I think there are going to be a lot of new applications. In particular, using light-based devices together with some accessory, whether it's a topical or a liquid of some other form. For example, in doing tattoo removal or treatment of benign pigmented lesions with a Q-switch laser, you can use a liquid called perfluorodecalan, which is an optical clearing agent that allows the light to get much deeper into the tissue, allows you to remove deeper tattoos and deeper benign pigmented lesions. And also the fact that you can create places within the skin where there's increased transport of topicals. You can take many of the topicals, whether they're moisturizers or something more potent, that for the last 50 years has had difficulty penetrating the topmost layer of skin, the stratum corneum, and now by either creating holes with an ablative fractional laser or creating so-called microthermal zones with a non-ablative laser, you can greatly increase the transport of that topical down into the epidermis and dermis, and therefore just get much better results. So lots of interesting stuff and exciting stuff going on with lasers in dermatology.